Hello there. Today is Monday, May 4th. This is VOA's International Edition. I'm Lori Lundin in Washington. Coming up, the U.S. is fast-tracking a drug that appears to be speeding up recovery for COVID patients.
There are patients out there that can benefit from this medicine today that are hospitalized, and we don't want any time to waste for that.
A U.S. report finds China hid the coronavirus severity to hoard supplies. Also ahead, a world-renowned rock band's iconic song has been reworked for those on the front lines of the pandemic. It's all on today's International Edition. As of Sunday, there were more than 1,092,000 people infected and at least 67,000 deaths in the United States from the novel coronavirus. As the number of cases rise, states are individually operating at their own pace in confronting the pandemic. The AP's Ed Donohue reports.
In Florida, Governor Ron DeSantis' phase one of reopening starts Monday.
We're going to begin doing our state parks so people can go. Now, there's obviously going to continue to be social distancing.
Restaurants and stores can also reopen Monday in Florida at 25% capacity. The stay-at-home order remains in Michigan, but Governor Gretchen Whitmer says some work can resume.
That includes construction work, real estate activities, and work that is primarily and traditionally performed outdoors.
And in Massachusetts, Governor Charlie Baker is ordering everyone there to wear face protection in public.
There's two reasons for that. One is obviously to protect you from others, but just as important is to protect others from you.
Baker plans to reopen Massachusetts May 18th. I'm Ed Donohue.
Well, as governors in about half of the United States partially reopen their economies, the governor of New York, the epicenter of the U.S. outbreak, is pushing back on pressures to reopen. AP correspondent Shelley Adler reports Governor Andrew Cuomo says it still isn't safe.
I'm not going to put dollar signs over human lives.
New York Governor Andrew Cuomo at a briefing in Queens on pressure to reopen the state.
I feel it. I get it. I disagree with people who say open the economy even though you know there's a public health risk. I disagree with that.
While he says hospitalizations are down along with intubations, new cases were a little over 800 Saturday and 299 people died. I'm Shelley Adler.
Following the results of a U.S. study released last week finding the antiviral drug remdesivir's promise in shortening recovery time for COVID-19 patients, the U.S. Food and Drug Administration is speeding up the drug's approval. It would normally go through a much more rigorous process. Daniel O'Day, CEO of Gilead Science, the manufacturer of the drug, says the company will be working to boost production and giving some of it away for free.
We want to make sure nothing gets in the way of these patients getting the medicine, so we made a decision to donate about 1.5 million vials of remdesivir. We'll be working with the government to determine how best to distribute that.
Meanwhile, U.S. officials are accusing China of covering up the initial extent of the outbreak and how contagious the disease is in order to stock up on medical supplies needed to respond to it. AP correspondent Tim McGuire reports the U.S. Secretary of State also has some additional accusations.
During an appearance on ABC's This Week, Secretary of State Mike Pompeo says he suspects the coronavirus pandemic began in a Chinese lab.
These are not the first times that we've had a world exposed to viruses as a result of failures in a Chinese lab.
Pompeo says U.S. intelligence agencies continue to look into the start of that pandemic.
Verify so that we are certain.
He also accuses the Chinese Communist Party and government of trying to prevent the rest of the world from finding out about the outbreak until it began to spread internationally, costing hundreds of thousands of lives. I'm Tim McGuire.
The UN Refugee Agency is warning of potentially devastating consequences for millions in South Sudan if the COVID-19 pandemic takes root and spreads uncontrollably throughout the country. Lisa Schlein reports for VOA from Geneva.
South Sudan, the world's youngest nation, was mired in war for decades before it gained independence in 2011, and for most of the time since. Years of conflict, floods, a recent swarm of locusts and other natural disasters have left millions of people unable to meet their most basic needs. The UN Refugee Agency warns this weakened population might be unable to ward off the coronavirus pandemic. To date, says UNHCR spokesman Baba Baloch, only 35 cases of the disease have been confirmed in South Sudan. But if the virus spreads rapidly, he tells VOA, this situation could quickly turn into a humanitarian crisis.
The threat of COVID, the pandemic, this could have deadly consequences for people where health structures are very weak, where 1.7 million people are displaced, where communal fighting is a real threat today.
Baloch says the international community must step forward urgently and do something to prevent this from happening. He says the country's health facilities have been largely damaged or destroyed during years of warfare. He says internally displaced people are living in crowded sites with poor sanitary conditions. He says many people lack access to clean water and hygiene facilities. He says preparations to tackle the pandemic should be taken now while the numbers of infections are still low.
This is the time that we want to use to put in place infrastructure or support authorities and people on the ground, that they are well prepared in case the numbers are going to go up. But let's not forget that the way this pandemic has been spreading, if you're not prepared, we could see many lives in danger in South Sudan.
The South Sudanese government has a high-level task force leading the battle against the coronavirus. The task force said Wednesday that 28 people newly infected with the virus have been quarantined. It is urging South Sudanese to follow precautions meant to limit the virus's spread. Meanwhile, the UN Refugee Agency, working with South Sudanese authorities, has constructed 5 emergency treatment centers. 5 more are set to be built in the coming weeks. The agency says this and other assistance programs it is operating on behalf of refugees and internally displaced people are costly. The UNHCR is appealing to international donors to be more generous than they have been so far, noting it has received only 11% of the $179 million it needs to meet the humanitarian needs of people inside South Sudan. Lisa Schlein for VOA News, Geneva.
The coronavirus pandemic is touching the lives of almost everyone in the world and has brought to light the many brave people on the front lines providing medical care, security, and food. But on Sunday's World Press Freedom Day, journalists in many ways are also being recognized as frontline soldiers, battling to provide the truth and factual information for citizens looking to make the right decisions for their families. I recently spoke to Dr. Courtney Radsch, Advocacy Director with the Committee to Protect Journalists. Here is part 2 of our 2-part interview.
I think journalists are one of the underappreciated frontline workers during the coronavirus. Of course, we are so grateful for the work that nurses and grocers and first responders are doing, but we really have to understand that many journalists themselves are first responders, especially photojournalists, video journalists, and those print reporters who are going out to the front lines, whether we're talking about the hospitals. And so, we're really concerned at the Committee to Protect Journalists, both about how to help journalists stay safe, because they are oftentimes putting their health at risk to go report the story. Obviously, not every story can be told remotely from a computer or a phone. And we're really concerned about the blowback against journalists in many parts of the world and the press freedom implications of this global pandemic.
They've been threatened, they've been banned, they've been in some places around the world imprisoned just for trying to get the truth out about the virus.
This is an unprecedented pandemic, but unfortunately, some of the responses that we're seeing are not out of line with what we saw in the aftermath of September 11th and the war on terror, where you had this widespread acknowledgement that terrorism is a problem, but it gets warped and misconstrued by governments around the world who then use that as a cover to clamp down on press freedom and on independent reporting. So that's what we're seeing with the coronavirus. We're seeing in countries like Iraq, Egypt, Iran, South Africa, really around the world, journalists who are reporting on coronavirus, especially if it has to do with official statistics versus what other reporting is showing about how many cases or how many deaths there have been. These journalists are then getting caught up and either, as you said, arrested, detained. In the case of Egypt, kicked out of the country. In the case of Iraq, Reuters had its license suspended temporarily. So there's this real battle over the truth. And I think one of the challenges is that there isn't necessarily a truth. There is an evolving set of facts, which may look different over time as new information comes to light, as new discoveries about the virus are made. So on the one hand, there isn't necessarily one global truth, although there are certainly officials who have valid information. And then you couple that with the interest of many countries in controlling the information environment, in making sure that there is no information out there that doesn't comport with the official version of reality, which in many cases does not comport to reality. And journalists are getting caught in the crosshairs because theirs is a public interest job.
Some of the other stories we are following at VOA News. Pope Francis called on Sunday for international scientific cooperation to discover a vaccine for the coronavirus and said any successful vaccine should be made available around the world. Francis, who has been delivering his Sunday address from the Papal Library instead of St. Peter's Square because of the lockdown in Italy, thanked all those around the world who were providing essential services. Iran plans to reopen mosques and schools in areas that have been consistently free of the coronavirus as President Hassan Rouhani's government starts to ease restrictions that were aimed at containing the outbreak. Mosques have been closed and religious gatherings banned since mid-March as the outbreak spread in Iran, the Middle East's hardest-hit country. Since then, Iranians have turned to drive-ins for ceremonies during the holy Muslim fasting month of Ramadan. Israel's Supreme Court began a two-day hearing on Sunday to determine whether Prime Minister Benjamin Netanyahu, who has been indicted for corruption, will be allowed to form a new government. A ruling against Netanyahu would likely trigger a snap election, the fourth since April 2019, as the country grapples with the coronavirus and its economic fallout. Stay with VOA for all the latest U.S. and up-to-date world news.